Hello friends, welcome to another episode of Samajh ke Rato, and today we are going to talk about the types of screws that we use for different maxillofacial surgeries in the fixation. Okay, it is very important from NEET and INICT exam point of view, and all those who are doing residency in maxillofacial surgery. Even for all of you, it is very important to understand the types of screws and where they are used. If you know it now, you will be able to use it correctly in your different patients. Alright, so very simply speaking, this is a screw. Alright, it has a head and it has a body. Alright, so this is a simple screw. Okay, simple screw that we use with all the mini plates. Okay, small plates, thin plates, simple screw that goes and engages the plate to the bone. Now if I have to talk about the parts of the screw, like I said, there is a head and this is the shank, which is the middle part, and then there is a body. Now you can see that in the body there is a core of the screw, which is like the solid part of the screw. So this blue part is the core, right? Core diameter, alright? And then there are threads. You can see that some parts there are like this spiral threads, which increase the diameter of the screw at certain points. Alright, so this external diameter of the screw, which is made up by the threads, is known as the external diameter. External diameter, which is made up by the threads, and core, which is made up of that solid part of the screw, which is in the center. Now why it is important is the drill that you will use to create a hole for the screw will correspond to the core diameter. Okay, so it is narrower than the external diameter. Okay, but the name of the screw, the name determinant of the screw will be the external diameter. For example, if I am doing a surgery and I have drilled a hole of 1.4 millimeter. So I will tell the sister, please give me a drill of 1.4 millimeter. So I will drill a hole of 1.4 millimeter, and in that hole, I will put a screw of 1.6 millimeter, which corresponds to the actual external diameter of the screw. Okay, if I drill a hole which is 1.6, then obviously my screw will be loose. Okay, my screw diameter, external diameter should be more, my drill size should be less. Only then the threads will engage the bone, only then the screw will be secure. Alright, so this is the external diameter of the screw, which is made up of threads, which determines the name of the screw, and the internal, the core diameter determines what will be the drill size when you drill a hole to fix that screw. Okay, so this is the parts, the basic parts of a screw. Now, when I use this screw in a small length that engages only the outer cortex, then it is called a monocortical screw. Mono means one, cortex means, cortical means cortex. Okay, so the screw which engages only one cortex, so mandible you know has a buccal cortex and a lingual cortex. So when you put the screw, you always put the screw through the buccal cortex. You cannot sit in the patient's mouth and put the screw lingually. You have to always put the screw from buccal side. So when the screw goes from the buccal cortex till the medulla and stops there, you call it a monocortical screw, which is short. Okay, 6 mm, 8 mm, depending on the size of the mandible. And if the screw goes through the cortex, reaches the medulla, crosses the medulla, and even crosses the other side of the cortex, that is the lingual cortex, you call it a bicortical screw. A bicortical screw. Okay, so this is the outer cortex where you put the plate, and this is the inner cortex or lingual cortex through which you put the bicortical screw. Monocortical screws usually used with mini plates. Bicortical screws usually used with thicker, bulkier plates like the reconstruction plate or the compression plate. Whenever you're using a bicortical screw, the rule is you only can use it in the lower border of mandible. Never ever on the middle, never ever on the top, because if you use it on the middle or top, you can damage the roots of the teeth, you can damage the neurovascular bundle. So whenever you're using bicortical screws, it has to be the lower border of mandible or the posterior edge of the ramus. If the same screw, I am increasing the length, okay, you call it a positional screw. Now you call it a positional screw. It is similar to a bicortical screw. It is somewhat similar to a bicortical screw, but you use this word positional typically for when you use it in orthognathic surgery. So suppose I have done a BSSO and I have advanced my mandible. I can fix this advanced mandible using mini plates and monocortical screws, or if I don't want to use plates, I can directly use these long screws which are bicortical and fix my osteotomy, fix my advancement or setback or whatever changes I have done. So these long screws which are bicortical, usually used to fix osteotomies in orthognathic surgery, they are known as positional screws. Now if the same screw, I have made the upper part smooth and the lower or the distal part as threaded, then I call it a lag screw. Same screw, increased length, but the upper part, which is one near the head, that is smooth, and the lower part is threaded. Such screw I call a lag screw. Okay, usually we use lag screws in the oblique fractures of the symphysis of mandible, in the anterior mandible, that is symphysial, parasymphysial fractures, which is like anterior to the mental foramen, and oblique fractures. That is a typical use of lag screw in maxillofacial region. Now you can also use the positional screw, which is this screw, in a lag screw fashion. How can you use the positional screw in a lag screw fashion? If I drill this hole wide, in spite of being threaded, it will act like a smooth screw, and this part hole I will drill as per the core diameter. Okay, so that will be the engaging hole, that will be the engaging part which catches hold of the other end of the cortex, and this will be the smooth part. Although it is threaded, but since the hole which I have made is very wide, it's a gliding hole, so still a positional screw can also be used in a lag screw principle. Next, if the same screw, if I put extra threads on the head is also threaded. Normally, the head is smooth, the shank is smooth, and the body is threaded. But if I put additional threads on the head, I will call it a locking screw. This is a locking screw. Locking screw mostly used with bulkier plates like reconstruction plates. It has many advantages. Screw loosening is less, you can change the direction, and compression on the blood on the bone is much lesser. So many advantages of locking screw. Most of the systems that are available nowadays are having locking plates and screws. Alright, so this is the locking screw which has additional threads in the head portion or the shank portion of the screw. Alright, and if this same screw, I put a hole on the head. If I put a hole on the head, then it becomes an IMF screw or an intermaxillary fixation screw. Alright, if I have to do an IMF in a minimally displaced or undisplaced fracture, I don't want to put an arch bar or I don't know how to put an arch bar, I can simply take 4 or 6 IMF screws, put them in the maxilla, put them in the mandible per mucosally. I don't even need to do any dissection. Just through the mucosa, I can put 4 screws, and using this hole, I can put wires and do a very quick IMF. Very quick intermaxillary fixation can be done with this kind of screw, which is exactly like the normal screw but with a hole in the head of the shank portion. So these are the IMF screws. Very quickly, let us revise. So this is a normal monocortical screw. This is a bicortical screw which can be used as a positional screw. This is a typical lag screw, although a positional screw can also be used in a lag fashion. This is a locking screw which has threads on the head, and this is the IMF screw which is used for a very quick intermaxillary fixation.